Right, we're on to item number 5. This is an add-on too. This is a COVID update. I'm gonna look at Mr. Skyles, and Mr. Skyles is gonna give us a little update that we all have been hearing, but make sure everybody understands it here in Itasca County.
Yeah, thank you, Mr. Chair and Commissioners. And yeah, it is a kind of a public service announcement. And I'll just quote a couple of numbers and some local providers, healthcare providers in our community. But right now, we are at 138.1 for our per 10,000 COVID rate. And so, whenever you do per 10,000, whatever, it just compares you able to compare yourself across the state, different population sizes. So it doesn't matter if you have 2,000 people or 100,000 people, you can compare yourself by that number. And our highest last year was 129. So we are almost 10% higher, or 10 points higher than we were at our highest point. So our COVID positive rate, regardless of vaccination status or whatever else, and is as high as it's ever been, and it really is hit a critical nature in our community, in our county. I want to thank Kelly and Vic for doing their public service announcements and getting out the press release. But just for a couple of quotes, according to Kelly Chandler, our public health director, it's never been this serious in our county. Again, having the highest rate. Aaron Saudi from Big Fork, the CEO up there, said beds in the Midwest are at a capacity that can't be managed, where they're managing patients in Big Fork that would benefit from a higher level of care, but there's no beds to refer them to. Gene McDonald, the CEO from Grand Itasca, said it's a critical moment for our community. At Grand Itasca, they're seeing historically high numbers of patients presenting to our emergency department and patients needing hospital or intensive care, and they're stretched to the limits. All local and regional facilities are feeling the same pressure. Now, we know that some of this pressure is due to staffing. I mean, we see it in our own county-owned facility where we can't get anywhere close to 100% because of the staff that we have, and all these facilities are feeling the same. But the result doesn't change the result of it's hard to find a bed, it's hard to find good care, and I'm not just talking COVID, I'm talking anything else. So really what the message is to try to be as safe as you can, not only with COVID, but any of your activities, because if you get in a deer hunting accident and you need care, you're going to get emergency care, but after that, you may be shipped a long way away, which is not good for the patient nor from the family members. And so just exercise as much caution, not only again with the pandemic disease, but in your personal life as well. So that's really the message that we want to get across.